I am Akila Jackson, and I'm going to be performing an NG2 insertion. So the first thing I will do is check the patient's chart, look at the order, and the reason why we are doing the NG2 insertion today, which would be for a bowel obstruction for this patient. I'm going to perform hand hygiene into the room, make sure there's adequate lighting, privacy, and so forth. So, hi, my name is Akila. I'll be your student nurse today. Can you please state your name and your birthday as I double check your ID band? All right, great. Are you having any pain at the moment? Any allergies to any medications? Any allergies to tape? All right, perfect. So I will be inserting an NG tube. I know that the doctor came in and spoke with you about this due to your bowel obstruction. Have you ever had an NG tube insertion? No? Okay. So what I will do is I'm going to insert a tube into one of your nostrils. So I will have you go ahead and place one of your fingers over your right nostril and breathe through your left. And now do the same on the opposite side. Okay, which nostril was easier for you to breathe through? Your left? Perfect. So I will be inserting the tube into your left nostril. I actually want to go ahead and take a look at your nostrils really quick. All right, perfect. I also want to go ahead and listen to your lung sounds and your bowel sounds and take a look at your stomach as well. Are you having any difficulty breathing at the moment? No? Okay, great. So I'm going to listen to your lung sounds to check. I'm trying to listen to find out if you have any wheezing or crackling in your lungs. All right, great news. They're clear. So first I want to take a look at your stomach. It's a little distended, which is to be expected because of your bowel obstruction. Now I'm going to take a listen. All right, minimal bowel sounds, which is also to be expected. Okay, so now we will go ahead and get started. So the first thing I would like to do is measure the NG2. I want to find out how deep we need to go to reach your stomach. So first, stretch it out a little bit. All right, there we go. So it can be more flexible. So I'll start at the tip of your nose, behind your ear, and I'm going to stop at your xiphoid process. All right, so I'm about 60 centimeters down, and what I am going to do is go down another 3 centimeters. All right, I'm going to mark that with my Sharpie so I can know where to stop at. Perfect. All right, I also have a piston syringe. I'm going to add 30 mLs of air. So I'm going to use this to, once the tube is inserted, so that way I can listen to see if I hear air go through the tube. Then I will know that we are in the appropriate place. I'll also draw out some of your gastric juices and measure it with my pH strip so I can make sure we are getting gastric juice and that we're in the right area. And after the procedure, we will also have a radiology tech come in and take an x-ray of your stomach to check for proper placement. Okay? All right, perfect. So now I will go ahead and apply some lubrication from the tip to about 2 inches up. All right, so please remain calm. Try not to grab the tube. I do have a tissue here just in case you do have some tears. And I have an emesis basin just in case you feel like you need to vomit. But please do not grab the tube, okay? Please do not move your head. I do not want you to get injured at all, okay? So I'm going to go ahead and start. I'm going to go at an angle and then go to the back of your throat. All right, you're doing good. I'm going to have you go ahead and lower your head. You are in a high Fowler's position at the moment. So I'm going to have you go ahead and lower your chin to your chest and go ahead and sip some water. Very good. You're doing great. Perfect. Keep on sipping. All right, you're almost there. Keep going. You're doing perfect. All right, we made it. We're at 63 centimeters. Great. Okay, how are you doing? Are you okay with breathing at the moment? Okay, perfect. So now I'm going to grab my piston syringe and insert it to the tube. All right, let me put my stethoscope back in. So I can listen for the air being pushed through. I'm going to have you hold that for me really quick. I'm sorry. All right, perfect. All right, place this on your stomach. Okay, push in the air. Oh, I heard the whooshing sound. I'm going to aspirate. All right, and note the color of your gastric juice is green, which is to be expected. And I'm going to go ahead and check that on the pH strip. All right, pH is less than 5. Looks like we're in the right spot. I'm going to apply my butterfly bandage to your nose to hold it in place. Great, and you said you had no allergies to tape, so I'm going to tape this to the side of your face. And make sure you have enough leeway so that way you can still turn your head and have full range of motion. Perfect. All right, so the suction has already been set up prior to me inserting the tube. So I'm going to go ahead and put it at continuous suctioning, 60 to 80 millimeters mercury. Connect the tube and switch it over to intermittent suctioning, so that way we didn't have any issues with the suctioning continuing even if your stomach is empty, because that could create an ulcer. All right, so I'm going to reevaluate. Listen to your lung sounds again. Perfect. I'm going to check your stomach. Looks like it went down, not as distended as it was before. And I'm listening to your sounds. All right. Do you have any questions for me? All right, so any pain, any nausea, and you feel like you're breathing just fine. Perfect. You didn't have any wheezing or crackling in your lungs either. So here's your call light. You're in a comfortable position. Bed is low, bed alarm on. Just give me a call if you need anything, okay? I'll go ahead and document my findings. Patient tolerated well. And that is it. Thank you.